Hi, sir.
Yeah.
Good afternoon.
Good afternoon.
It's a pleasure for us to finally meet you, and you being a great neurointerventional radiologist. Um, it, I mean, it's a great asset to Elitemed.care to have you to talk about interventional radiology. And I know that those who are watching this and the students who are watching this, they will get inspired. They'll get to know like what really interventional radiology is. So, yeah, please tell me, sir.
So, first of all, intervention radiology is not like a radiology branch per se. So, radiology, people take it as very relaxed way, but it should not be taken. Any branch should not be taken relaxed way. Many people choose radiology just to relax or something. So that is not the way actually. First of all, that also. But when you come to the intervention radiology proper, the intervention radiology is purely a clinical kind of a job, and most of the time our work start when the clinician finish their work. So clinician go home, the surgeon finish his operation by evening, and he go home. But most of the time we will get our calls in the night only. Our job actually most of the time our job starts in the night only. We'll get a call saying that there is a collection, there is a bleeding. So all these uh, situations are like emergency situations where we cannot deny further treatment. So we'll, as an intervention radiologist, we should always be on our toes, whether it is a night time, daytime, early morning. So it is a proper clinician job. You can compare that to if you compare it to some other branch, I can compare it to like a neurosurgeon. The neurosurgeon is like 24-hour busy. So that's how a proper intervention is like actually.
Okay. So, can you share a personal anecdote or a story that illustrates the impact you had on a patient's life through interventional radiology? I know there
See,
will be
it
plenty
is,
because you
yeah,
are a
it is not like
neurointerventional
one or
radiologist.
two. Every case have the story like that. If you take a daily basis example, a stroke, if you any patient encounter a major stroke, if you don't treat it, it's like loss of a limb or loss of a speech for
Yes.
entire rest of his
Yes,
life,
disabled for rest of
disabled
their
for
life.
rest of his life. But yes, neurologists, they are doing a thrombolysis,
Hmm.
but the thrombolysis will have effect around between 5 to 15% of our patient only will get better with
Yes,
thrombolysis.
yes.
But when you do neurointervention, I personally have experience of showing a good result in up to 70%.
Wow. Okay.
So internationally, it is around 50 to 60%. But we personally, when I was in Chennai, we shown a good outcome where patient be independent in up to 70% of our patients. So that's how it is. That's how it is wonderful. And we have personal testimonials also from the patient where they came unconscious, they walk back home completely normal, like
Yes.
normal individual. So they all are the stories, and those stories only actually motivates us to do more work.
Yes.
Those stories only make us, I mean, whether it is night or day, it makes us equal. So they all are motivating stories.
Why do you think, sir, back in India, why most of the stroke cases are not being managed by a neurointervention? Or most of the.
So no, it is not like that. Neurointerventionists or neuroradiologists, they are managing it only very nicely now in India also.
I mean, if they get the case.
If
But most of the patients doesn't know.
Yeah, most basically, why the patients are not coming to the neurointerventionist is lack of awareness.
Yes.
The biggest challenge is that window period. We have a stroke window period. Initially, it was 6 hours. Now it has extended up to 24 hours in selected patients. But most of the time, they'll come up to 24 hours.
Yes.
So That lack of awareness is one of the biggest bottleneck where most of them they will not reach us.
Yeah.
So the awareness, creating awareness is most important part of stroke treatment actually.
Yeah.
Yeah.
So me being, I mean, like I have been working as a general physician back in Kerala. So just with my knowledge in working as a GP or as a casualty medical officer in multiple hospitals, in fact in government hospitals there in Kerala, I have seen that patients come to hospital in that initial 1 to 2 hours when they start having any kind of a disability or any kind of a loss of any weakness that is experiencing and all that, but they are not told like how they are being told about angioplasty.
Yeah.
They're not told about a stroke management, or no one is giving them the awareness.
Yeah, one more important thing, what back in India when I was doing my practice, one more important thing is, it is not the general public they need the awareness first. It is the physicians who are in first contact of a patient. Most of the physicians at a village level, they lack this awareness.
Yes.
This is very important. The physicians has to be given awareness first, and then you can go to the general public awareness. When I was in India, we used to conduct a weekly basis for the awareness only for the physicians, where you used to go and meet clinician to clinician, not even in big cities, going to the village and meeting all the physicians. And that actually impacted in a great way also. We used to get a lot of patients from them. And it is not only like an Ayurvedic doctor who don't know it. Even the general physicians, MD physicians are also like, they don't know it.
They don't know it.
Even if they know it, they don't know where to send it. So these all are things we have to consider it while addressing the awareness campaigns.
Yeah.
Where we are doing, where you are operating. So what are the ways to send the patients? So these all has to be discussed during the awareness campaign.
Yes.
And definitely India being such a big country and such a big population, so this awareness requires. Definitely.
And it's a patient's right to know about
Yes.
a procedure like this that exists.
Yes.
Otherwise, they are leading their life with a disability, all their
Disability
life
for rest
long.
of their life.
Rest of their life.
Yeah.
Yes. And we know that surgery is scary. Everybody knows surgery is scary.
Yeah.
And just for the public, is it like a surgery? What is the difference like?
No, it is not like a surgery actually. Surgery is like any surgery is cutting actually. We hardly cut anything. Our maximum incision would be around 1 centimeter, always around 0.5 mm or 5 mm we can call. So it's not like a surgery. It is most of the time a daycare procedure for us, except some of the emergencies like stroke and aneurysm coiling and all. We'll keep for few days. Otherwise, most of the procedures like ablations, varicose veins, these all are daycare procedures.
Okay.
Yeah. So we'll admit in the morning and discharge in the evening. And the risk associated with surgery are different, and the risk associated with intervention procedures are different. The risk, if I tell, the surgery usually carries a little bit a scarier risk actually. So when it comes to intervention radiology, definitely they are if any risk, they are minor risk actually.
Okay.
Yeah, that's how it is.
That is nice. And sir, you have worked back in India, multiple places in India, and also here in Dubai. How do you feel? What is the difference when it comes to IR?
IR. So yeah, in India it is a different scenario actually. Basically, um, cost is an issue in India basically. For example, if you want to treat aneurysm coiling, a neurosurgeon can clip it in even in private hospital at a lesser money, but the cost will almost double for the coiling.
Okay.
That is one of the issue in India. So same is true for stroke also. Thrombolysis, most of the they will do it, and many times we know that yes, I have pushed patients for the treatment, even if they are very poor. I have done thrombectomy even in 30, 40,000 also.
Okay.
But most of the time it is not possible.
Okay.
We need certain amount. Actually, now I think government has introduced some health insurance and something. I
Okay.
don't know what is impact of that right now.
Mm.
But in India, that is one of the biggest issue.
Still, the insurance is not much not covering much of the interventional radiology procedures.
But that has to be. That
That
has to
has
be.
to be the thing.
Yeah,
Yes.
at least for the emergency procedures. Like if I speak about intervention procedures only, for example, stroke, that has to be straight away has to be covered.
Yes.
By the government schemes. Aneurysms, especially the ruptured aneurysms, straight away there is no waiting or anything. Any bleeders, GI bleeders or any bleeders in the body, there is no waiting.
Yeah.
The bleeders are more emergency than a stroke. Stroke, at least person can survive with some disability. Any bleeders in the body, it has to be tackled immediately and it has to be treated. If you don't, then patient will die in hours. So these are all few of the procedures where it has to be covered immediately. Okay. And rest all procedures also, they are like equally, I mean, better than surgery many times, and that also has to be covered in all the schemes. And I don't know whether to tell this in your interview or not, but the scheme makers who are sitting in the center and making the scheme also, they should also involve a good panel of intervention radiologists across India to consider, I mean, to introduce how much to offer for all these procedures and all.
Yes.
It's not like one person who don't know anything about intervention radiology coming and deciding about. Basically, the one who is making all the schemes and all, they are actually like they are not even a general radiologist actually properly. How can they actually discuss about the scheme for the intervention radiology? So the panel also should be a proper one.
Yeah.
If you go to like a neurosurgery panel, they definitely have a neurosurgeon, proper neurosurgeon. Neurologist, they have a proper neurologist to make all the schemes. So same way the for intervention schemes also, they have to include a proper representation of intervention radiologist in that panel, and then they have to decide it.
Yes.
This is also very important.
Sir, and also for the medical students and my peer group people who will be watching this, what was the moment where that changed when you went for your master's in surgery and then you switched to interventional radiology? That moment
Yes.
where how did you think that okay, I wanted to become an interventional radiologist? Like,
see, I wanted to be a neurosurgeon first, and yeah, brain related things they actually excited me since my um, MBBS time, and that's how by choice I was getting all the seats actually, but by choice I took surgery there. But surgery right now, I think in PGI it has improved a lot, the training. During my time in 2011, it was general surgery training was not very great. So for surgeon, basically how much you are cutting, that is very important. So anyway, I think it is. I did not felt very comfortable. That might be very good also for some people, but I did not felt very comfortable.
What do you think that change made in your life? Yes.
So yeah, so I actually decided like I'll go the other route actually. So I'll do like radiology and then neuroradiology, because I came to know that there is a neuroradiology branch also in PGI where they are doing all the neuro procedures. So from there, I left surgery and immediately I took next exam. I took a radiology and then I became a neuroradiologist.
So do you think that the medical students, like us, like we decide which branch to take during our internship period or during our final year period? Like that is where we decide like where to go or how to do. And do you think that if they get to know about interventional radiology, or if this is included in their curriculum about interventional radiology, not the radiology, will there be larger crowd or larger students they can take up
Definitely.
interventional radiology?
Yes, definitely. So that stimulus is lacking. Till I mean, I landed up in PGI. Till then, I was not knowing what is intervention radiology. I never heard of also.
Yes.
I mean, even for the entrance also, we hardly see a few questions regarding radiology. That too, like physics kind of questions. And I don't know right now how much in MBBS books there, including the radiology also. So once they get that stimulus, definitely there will be a lot of students who are passionate about this. Because, see, for example, I don't know, maybe when I was doing my MBBS, if I knew radiology or neuroradiology, I would have fascinated about that since my MBBS itself, and I could not have deviated somewhere else.
Yes.
So definitely, every student has to be stimulated about it, and I don't know how to do that in India. In Europe and US and all, they are already by MBBS they'll be knowing it. Yeah, they know it actually. And I think probably in PGI and AIMS they already, I think, thinking about it like MD intervention radiology itself.
Yeah, that
Not like imaging.
Imaging, yes.
Like MD clinic, whatever MD medicine or MS surgery, there is MD intervention radiology itself, where parallelly they'll taught about imaging and intervention as well. Right now also they are teaching about it, but I think vaguely I heard about it, but I don't know how much it is true. That has to be explored.
Okay. Yeah. Oh, that's wonderful. Okay, sir. I mean, it is wonderful talking to you, and thanks for giving us time in your busy schedule here in Dubai. Thank you so much, sir.